I'm reading from an article on the Science Daily, and I'm going to read this to you. It's called Cloth Masks Dangerous to Your Health. This was written on April the 22nd on 2015. The source is the University of New South Wales, and the summary is: respiratory infection is much higher among healthcare workers wearing cloth masks compared to medical masks, research shows. Cloth masks should not be used by workers in any healthcare settings at all, the authors of the new study say. Bear in mind that everybody right now is wearing a cloth mask, okay? The widespread use of cloth masks by healthcare workers may actually put them at increased risk of respiratory illness and viral infections, and their global use should be discouraged, according to a University of New South Wales study. So check that out, yeah? They're saying that the widespread use of cloth masks by healthcare workers may actually put them at increased risk of respiratory illness and viral infection, and the global use should be discouraged. Everybody has got one on at the moment. Think about the people who are sitting in hospital who have become ill, and they have been given a mask in hospital. Now, I've asked my mum, I've spoken to her. I actually called her before making this video because my mum was in hospital in March for a week. Okay, now, you know what's happened with my mum. My mum had the flu jab, and my mum also had a pneumonia jab. She then had the COVID-19 symptoms. She went into hospital, and then she caught pneumonia. She didn't go in hospital with pneumonia. I've asked her how many times during that week can she remember that they changed her mask, her cloth mask. And she said to me at least a couple from what she can remember. So in a week, she had 2 masks in a week. Okay, so everybody in hospital at this moment, if you know anyone that is in hospital, not many of us do, but if you do, yeah, if there is anyone going into the hospital, make sure that person that is in hospital has their own set of masks themselves, because the nurses aren't giving you new masks every day, which you should be getting, yeah? A cloth mask. Make sure you're changing your mask every day. Throw them away. Just get a piece of cloth and wash it if you have to. Don't be spending money on this, people in hospital, because it is dangerous. You may well catch pneumonia whilst being in hospital. Yeah, so you're going in there with slight symptoms, and you're getting even worse whilst you're in there. So this study just proves that wearing a cloth mask makes you more susceptible to getting a viral infection yourself and a respiratory illness, because you're breathing in and you're not breathing as you should be, and you're not getting enough air either. So let's have a look at this. The results of the first randomised clinical trial, RCT, to study the benefits of cloth masks were published in the journal BMJ Open. The trial saw 1,607 hospital healthcare workers across 14 hospitals in the Vietnamese capital Hanoi, split into 3 groups: those wearing medical masks, those wearing cloth masks, and a control group based on usual practice, which included mask wearing. Workers used the mask on every shift on 4 consecutive weeks. The study found respiratory infection was much higher among healthcare workers wearing cloth masks. The penetration of cloth masks by particles was almost 97% compared to medical masks, which was 44%. Professor Rani McIntyre, lead study author and head of the University of South Wales School of Public Health and Community Medicine, said the results of the study caution against the use of cloth masks. Masks are worn to protect from infection during pandemics and outbreaks, especially when there are no drugs or vaccines available for protection, Professor McIntyre said. Masks are especially important for frontline doctors and nurses, as their protection from infection is key to maintaining the ability to tackle a pandemic effectively. We should be cautious about cloth masks used in healthcare settings, particularly high-risk situations such as emergency departments, intensive care, paediatric or respiratory wards. Cloth masks remain widely used globally because they are cheaper. They're a cheaper option especially in areas where there are a shortage of protective equipment, including in Asian countries, which have historically been affected by emerging infectious diseases, as well as West Africa, which was the epicenter for the recent Ebola epidemic. The authors speculate that the cloth mask's moisture retention, listen up good, the authors speculate that the cloth mask's moisture retention, their reuse and poor filtration may explain the increased risk of infection. This is what we've all been saying, okay? Now, we've all been saying it, but we all got fact checked and we were told that it was wrong. So what I've done is I've gone into some scholar papers, I've looked into medical people themselves saying this. Okay, now this whole thing is telling you that a cloth mask remains moist, because it would. Your breath keeps going on it, in and out, condensation, it's going to get wet. Now what happens is that moisture is a breeding ground. Okay, it's an absolute breeding ground. It's a petri dish for germs and all sorts of stuff, because you are breathing out and making the mask wet, and then when you're breathing in, you're pulling in whatever particles you're pulling in, that's mixing with the moisture, as well as the bacteria and stuff that's coming out of you, going back and mixing into that lovely cloth mask, and then you're breathing it all back in, and that's what's making you sick. So people that wear cloth masks are more likely to get a viral infection or a respiratory disease. The widespread use of cloth masks by healthcare workers and now most of the human population may actually put them at increased risk of respiratory illness and viral infections, and their global use should be discouraged. This is a paper from 2015. Peace out.